Today's video is all about the nose. It's a central feature of our faces, and over time it's subject to some of the same aging changes that happen elsewhere. On this plastic skull here, we have the nasal aperture, or the hole in the skull. We've got that bone, which is the nasal bone. Then that extends onto cartilage and skin. We've got little pockets of fat underneath there, and we've also got muscles that help scrunch up the nose and lift the top lip. Over time, what happens is the aperture or hole here gets bigger and bigger because the skull is constantly evolving over our lifetimes. And what happens then is we lose some support and the nose tends to drop down, especially the tip. We know that over time then the muscles mentalis in the chin can often get overactive, and the jawbone here, the mandible, is shrinking. So from the side, the two of them almost seem like they're beginning to meet, and people say, oh, my nose has dropped, or it can look bigger or it can look longer. Men are more prone to these changes than women are, but they happen to all of us. Also, over time, even without a nasal injury or nasal fracture, people will say that they're getting a hump on their nose. And what's happening is we lose fat above this little dorsal hump here. So we lose fat above and we lose fat below, and this dorsal hump can become really apparent. As well, the tip drops down and it starts to sometimes make the nostrils look a little bit wider, or a nostril flare here. And overall, these changes, some people don't consider very attractive, and they'll often come into us looking for solutions. What happens to the skin as well is over time it starts to thin, and generally the skin there is fairly thick compared to other areas, say for example the eyelids, where it's very thin and delicate. But over time that skin is starting to sag and the pores are enlarging, and people will often come in and say their nose looks less refined or elegant, the tip can look a bit bulbous or a bit bulging out, and the pores can be more obvious. So all of these are changes that are happening in the nose over time. What can you do? The first is always to use your skincare, and that's your SPF every single day. Because the nose is really vulnerable and kind of standing out on the face, it's also prone to sun damage, and sometimes we'll see age spots or pigmentation, or we'll also see what are called BCCs, basal cell carcinomas, or rodent ulcers. And those are little tiny little scabby lesions on the face, the ears, the nose, and these happen over time. If somebody has ever had an injury to their nose or they fracture their nose, then generally I wouldn't do fillers in the clinic. I would refer them to an ear, nose and throat surgeon, because the blood vessels after surgery or after an injury can be altered, and it makes the process more risky, and sometimes they're better seen by a surgeon rather than myself. So that really depends on what the history is, and also if they've got any breathing difficulties, because with things like dermal fillers here we can improve the form or the appearance of the nose, but if there's a functional problem inside with breathing or breathing difficulties, we refer on to an ENT colleague and keeps it safe. So I hope that's useful, and feel free to get in touch if you've any questions. Take care, bye.